Hi guys, in this video we are going to start with clavipectoral fascia and sections of axilla, part of upper limb anatomy. So let's begin without any delay. So clavipectoral fascia and sections of axilla. So clavipectoral fascia. Clavipectoral fascia is basically muscle enclosed is pectoralis minor and subclavius. These two things. So you can see over here in this diagram. This is basically pectoralis major, and that's inside it will be pectoralis minor from the third, fourth, and fifth nerve, and this is what we have is a subclavius muscle. That's a clavicle and subclavius muscle. So what with these two are the contents of clavipectoral fascia, and the extension, it extends as a suspensory ligament of axilla below the pectoralis minor. As you can see, clavipectoral fascia, clavicle and pectoralis is extends as suspensory ligament of axilla, that is below the pectoralis minor muscle. Structures piercing the clavipectoral fascia are thoracoacromial artery, cephalic vein, then basically a lateral pectoral nerve, and in lymphatics we have apical lymph node. As you can see in this diagram of the clavipectoral fascia, what is it clearly shown? It continues downward at the suspensory ligament of fascia, that is basically what below pectoralis minor, that's the suspensory ligament of fascia. Then what you have is this fascia means basically it's kind of a very thin layer just below the pectoralis minor. Muscles it is enclosing are the pectoralis minor, and another muscle which is getting enclosed is the subclavius. So pectoralis minor muscle and subclavius, both of them are getting enclosed in it, in the fascia. And you can see the subclavius muscle also. So this muscle we can see the subclavius muscle and pectoralis minor, and the content of it are basically thoracoacromial artery. Where to show? Okay, see this. Here you can see the subclavius muscle and the clavicle, and that's the pectoralis major muscle and pectoralis minor muscle. And what is suspension ligament of the pectoralis minor muscle? As it continues, the fascia continues as a fascia basically covers the pectoralis minor, and it contains suspensory ligament of the axilla. And as you can see in this diagram, that here it is covering thoracoacromial artery, the cephalic vein, and the lateral pectoral nerve. That's the contents of anterior wall of axilla. Very important content, because anterior wall of axilla consists of the clavicles, subclavius, then that's known as a clavicopectoral fascia. You can see because it starts from clavicle and extend up to the pectoralis minor muscle, and it contains of thoracoacromial artery. Then it consists of basically cephalic vein and the lateral pectoral nerve. You can write like thoracoacromial artery, cephalic vein, and lateral pectoral nerve. Now what we have next is basically this anterior wall of axilla done. Now we'll go to posterior wall of axilla. Here again we have the clavicle, subclavius, all the contents once again: pectoralis minor, pectoralis major, suspensory ligament of axilla, this pectoralis major muscle, clavipectoral fascia. Then we have this axilla, posterior part. Here it was anterior part of axilla. In the posterior part we have this subscapularis muscle, teres major and latissimus dorsi getting inserted on the basically supracondylar region of the humerus. So sorry, not supracondylar region of humerus, they both of them getting inserted on the scapular region, at the base of the scapula we can see, and axilla content. Then what we have next is this one, which is known as the muscles forming the posterior wall of axilla. Again same, as you can see this muscle is subscapularis. Then this muscle is known as a latissimus dorsi and teres major. As you can see, these are getting inserted on the basically the anterior shaft of the humerus. You can see anterior part or anterior shaft of the humerus. These two muscles are getting inserted. That's just posterior wall, anterior. Yes, and this is basically the subscapularis, then teres major, latissimus dorsi, and what we have is basically here is this muscles forming the posterior wall of axilla. These four muscles: subscapularis, teres major and latissimus dorsi. You can see these muscles also. Muscles forming the posterior wall of axilla, and that's basically the structures forming the anterior wall of axilla. So now contents of anterior wall of axilla and the muscles forming the posterior wall of axilla are clear. Now let's move to the transverse section of axilla. Transverse section of axilla, what all is there? Basically we have the pectoralis major and minor muscle upon the transverse section. Then what we have the short head of biceps brachii and coracobrachialis around the humerus, and we have the subscapularis muscle, and basically we have the serratus anterior muscle, which is very important. Now let's talk about boundaries and contents of axilla. So boundaries of axilla, anterior wall, pectoralis major and minor. As you can see in this diagram shows basically the anterior wall. Here you can see the anterior wall, pectoralis minor and pectoralis major. That's the first thing, anterior wall. Then next we have is basically posterior wall formed by subscapularis, teres major and latissimus dorsi. As you can see, subscapularis is there, teres major is there, and latissimus dorsi is there. Then medial wall up to 4 to 5 ribs with the intercostal spaces and serratus anterior. So that's the serratus anterior, you can see, and this is medial wall, serratus anterior, and 4 to 5 rib spaces, intercostal spaces and vertebral ribs. Then what we have next is basically lateral wall formed by coracobrachialis, short head of biceps brachii. So this is what is around the humerus, that is coracobrachialis and short head of biceps brachii tendon. Then what we have is this base of axilla consists of skin, superficial fascia and deep fascia, that is between anterior and posterior axillary fold. What we have next is this content of axillary sheath. This axillary sheath, this structure is called as an axillary sheath. I can show you here, see. So this structure is basically called as an axillary sheath. In the axillary sheath, there is an extension of prevertebral fossa, and this prevertebral fascia will basically consist of the axillary vessels and the cords of brachial plexus. That is cords of brachial plexus, in which we have what cords? In which we have basically we have the lateral cord, then we have the medial cord, and we have the posterior cord. So lateral, medial and the posterior cords of brachial plexus are present. Then we have this axillary sheath, and we have basically axillary sheath vessels, cords of brachial plexus. Axillary vessels, as it suggests the names, it means that it consists of what? It consists of an artery and it consists of a vein. So both of them, axillary vessels, then we have lateral medial cord in the axillary sheath. And what we have, fibrofatty tissue, axillary tail of Spence, and we have long thoracic nerve that is supplying the serratus anterior muscle. As we saw, this is basically axillary sheath is just like this is the ribs, and around the ribs covering is the serratus anterior, which form basically the medial wall of the axilla. So medial wall forming this ribs and serratus anterior muscle. So that long thoracic nerve, which basically is covered, so just the long thoracic nerve. So this is the diagram. What I've drawn here is basically more clear diagram. Axillary sheath, axillary vessels, then basically long thoracic nerve supplying the serratus muscle. Then what we have is basically all the cords, and we have the what we have is fibrofatty tissue and axillary tail of Spence. Now we will move to our next topic, which is a very important topic known as a brachial plexus and the injuries. Next, what we talk about is formation and branches of brachial plexus. Basically, brachial means arm. The word brachial suggests arm, and the word plexus suggests network. Therefore, brachial plexus means a network of the nerves around the arm is known as brachial plexus. What is the advantage of this plexus? The advantage is that this plexus enhances the nerve supply to the muscles of arm and forearm. What is the formation? I'll tell you in detail. Now see this diagram first. The formation, basically plexus looks like here, the three-dimensional diagram. So what is the formation done by? I'll tell one by one. Basically, for the brachial plexus is formed by the primary rami of C5, C6, C7, C8 and T1. So as I can show, this is we can call as a primary rami of C5. then C6, C7, C8. Then we have basically an C5, C6, C7, C8 and T1. Yeah, like this. This is how the brachial plexus is formed. And next is variations are there, that is prefix and postfix. That is brachial plexus originates from the C4 and less contribution from the T1, and postfix is basically receives the contribution from C5, C6, C7, C8 and T1 and T2. These two are the variations which are present. So this is basically how the formation of brachial plexus has taken place from C5, C6, C7, C8 and T1. Next, what we have is the roots. So we divide the brachial plexus as the following. First, what we have is the root, then we have the trunk, then divisions, and lastly we have the cords. So in roots, we have basically roots coming from C5, C6 conjoining together as one. Then we have C7, and then we have C8 and T1 conjoining together as one. So in which have basically upper root, middle root and lower root, three of them. So C5 and C6 forms the upper root together. C7 individually forms the middle root, and C8 and T1 forms the lower root. So such a way upper, middle and lower three trunks are formed from the roots C5, C6 upper trunk, C7 middle trunk and C8 and T1 for lower trunk. Next what we form is a division. Now the upper trunk is now getting divided into anterior and posterior division. It's very important. So now let's name them. So this division which you are seeing now, that's the anterior division. That's the anterior division, and this division is the posterior division. Two of them. Now the middle trunk is again getting divided. That's the anterior division of middle trunk, and that's the posterior division. And your lower trunk mein, that's the anterior and that's the posterior. The one which is shown by arrow is the posterior division. So as you can see, the anterior division of the upper trunk and the posterior division and the anterior division of the middle trunk, both of them are forming the lateral cord. So we can see here that lateral cord is formed by anterior division of upper trunk and plus anterior division of this middle trunk. Then what we have is the posterior cord. So this posterior cord is formed by the posterior division of the upper, middle and lower trunk. So upper, middle and lower trunk, all the trunks के posterior divisions form the posterior cord. And now this is the medial cord. This medial cord is formed by the anterior division of the lower trunk itself. No other thing forms the medial. So now what is, after understanding the brachial plexus structure, what are the branches of brachial plexus? In divisions, you can see there are no branches to the brachial plexus, but roots, in roots it has branches, that is the dorsal scapular nerve C5. Basically what happens is, this is the dorsal surface, that's the levator scapulae, rhomboid minor and rhomboid major. So dorsal scapular nerve C5 supplies it. Then there is a long thoracic nerve, that's a branch of basically C5, C6 and C7. This nerve is important because basically these nerves forms the content, as I told you, it supplies the serratus anterior muscle also. So it forms lateral thoracic nerve. It forms the content of serratus muscle. It forms the content of axillary sheath, and it's very important nerve, and it formed by the root of C5, C6 and C7. So we can say that from here, from the C5, C6 and C7, what is the branch which is coming is known as C5, C6 and C7. The branch coming known as basically is known as the long thoracic nerve, and we have a dorsal scapular nerve also. So yes, long thoracic nerve and dorsal scapular nerve also supplying the serratus anterior muscle on the ventral surface. On the dorsal surface of the scapula, supplying the levator scapulae, rhomboid major and rhomboid minor. As you can see, what is it supplying? Levator scapulae, rhomboid major and rhomboid minor. To these three muscles are getting nerve supply from dorsal scapular nerve, which is the C5, and serratus getting supply from the long thoracic nerve. Talking about the upper trunk, that was about roots. Now talking about the upper trunk. In the upper trunk there is a suprascapular nerve. As you can see over here, there is a suprascapular nerve which is there on the upper trunk. That is supraspinatus is almost 0 to 15 degree of abduction of shoulder, and there is a infraspinatus, that is suprascapular nerve it gives. And then we have nerve to subclavius, which basically shows the subclavius muscle nerve supply. I will show one by one. So next, what we important to understand is this diagram.